So I'm Dr. Avani Maniar. I'm a practicing dermatologist and I have my own clinic at Ghatkopar East, and we deal with everything under the sun which comes in your ectoderm. So that is your hair, skin and nails. Now it's not different. All of them behave the same way. All three are aspects of our skin, I would say. So it's not something different. What you expect, what people expect, that hair is a salon person's property. It's not like that. It's your property. You can deal with it day in and out and make it better at home. So we're going to talk about tips of what all to do naturally, and of course what all can be done in parlors and salons, and what should be done with our dermatologist. So we will go one after the other in specific order, with home therapies first and then go to the rest. If you have queries, as Riddhi has already mentioned, we will take it up in the end of this talk. So we would start with it now. Riddhi?
Yes, please. You can share your screen and begin with the presentation, Doctor.
Yeah.
Yes, we're able to see your screen.
Yeah, I'm just starting with the slideshow. Just a second.
Sure. Please take your time.
It's not starting with the first screen, that's why.
No problem. You can take your time to send this.
Can you share it, Riddhi, if you have it?
Yeah, just give me a second.
Because when I'm sharing, it's stopping at a particular screen. Yes. So let's talk about do's and don'ts in skin and hair care. Riddhi, you can go ahead with the screen. So I'm not going to be reading from the slide. What I'll be talking about is what exactly happens to the skin. So the way we treat our skin is how we would expect our skin to behave. So the way how good you are with the skin and hair, it would do the same thing to you. So to keep it healthy, you have to pamper it. So the more pampered you are, you boost the happy chemicals in your skin and the skin becomes better. Not everybody's skin is same, so we need to listen to our skin. Some people have a T-zone, some people have a oily combination skin, some people have extremely dry skin or atopic skin. So when we talk about these multiple skin types, the solution or the routine skincare also keeps changing for the same. So what is a basic skin routine we should have? So we have to make it our own. So do not follow all the trends which your friends follow. It doesn't make sense for your skin. So if you have extremely oily skin, if somebody tells you to moisturize every day, twice a day, you will have zits and breakouts. If you use a over-the-counter moisturizing cream, which is to be used on the body, on the face, you will of course have breakouts. So it's important to read the off-label uses of what you are buying over the counter and check whether it is comedogenic or not. So let's go to the next slide. Riddhi, the next one. So the best skin is without any makeup. So if you can go without a makeup on a routine day, that means you're taking good care of your skin. So it depends from person to person what all you need to use for that. Sunscreen is a must. That is not considered makeup. So you need to use a sunscreen day in and out. The next slide. So I have patients coming in my clinic with a box of stuff which they have bought online or with recommendation of friends and well-wishers and good wishers, and they have no idea how to use it. And these are young girls, teenagers, two middle-aged moms, parents who are worried about what their daughters are using or their sons are using. And also, of course, us who are middle-aged by ourselves, but we have never used it in our lives. So we need to know what to use and when to use it. So I don't know what all everybody uses, what my basic skincare routine would be. There would be cleansing, there would be a serum, there would be a moisturizer, there would be a sunscreen. Four things is a must. And then your actives in the night. So these four things and an extra thing in the night makes your skin routine the best. Now, some people add vitamin C to it. They add hyaluronic acid to it. Now, this is something an add-on. Some people take oral supplements of collagen. Again, these are add-ons. Not everybody can do it day in and out. So these are the things which we can add on. If I have 10 different things to use, what order to use them in? So we are going to be touching those points here. How do we layer a product? What all to be used first? What all to be used next? And the last thing has to be a cream-based formulation. So when we start with a routine product, we have gel-based, which is really watery. We have something which is like a serum. We have oils. We have lotions. We have creams. Now, all of them have a different texture. The hint here is you start from the thinnest to the thickest. So always layer yourself, try the product on your palm or on the back of your hand, feel the product. The stickier it is, the more easily spreadable it is, thinner it needs to go first. Thicker it is, more oily, it needs to go last. So the creams always come the last. Whenever we are applying things, at the end is always your moisturizer or your sunscreen, because that is something which closes all your actives on the skin. The next one. So the step one, as I said, we cannot all live without a cleanser. So in the morning, start your morning routine with a cleanser. What type of a cleanser to use? Every season changes it. So if we are in the summer season, we are going to get more oily. We are going to sweat out more. So the cleanser needs to be foam based. It needs to be a little stronger. So we can use a salicylic acid cleanser or a vitamin C cleanser for milder skin. Again, the foam helps. You should not be using creamy cleansers in the summer because it will not feel fresh at the end of the day. That should be the first step. The second step, Riddhi, the next slide. The second step is using a toner. Now, why do we need a toner? Not everybody uses a toner. We get a lot of open pores around our malar line, along the bridge of the nose, along the chin. Now, these are the areas where your pores open up as we age. That's because your collagen is getting depleted inside your skin. So the pores are going to open in size, they are not going to close back. The minute we use a toner, the toner closes down the pores. So it improves your skin texture. It does not make it look like a ripe orange. It needs to be fresher. So when we use a toner, it closes down the pores. The toner needs to be now non-alcoholic. Now, why earlier we used to be using alcoholic toners, the Lakme ones, just for example. So those were available over the counter. Now there are micellar waters available. Now there is rose water, which was available even in the olden days. We never used to use it because it smells. The micellar water is extremely useful because it removes your makeup, one, but it acts as a toner also. So it's a good investment to do. Use a micellar water which is non-alcoholic. So that has oils in it also. It will replenish your skin. It will remove your makeup. It will close down the pores. So everything done in one go. But that needs to be done post cleansing. So this can be done twice a day, in the night and in the morning. Let's go to the next one. So step 3, not everybody uses an antioxidant serum, especially for people having darker skin, very dull looking skin. They should add this to their regime so that it kind of refreshes it. It comes in a form of mist as well as a serum. So after the toner, switch to a vitamin C or an antioxidant serum. First thing, application around the eyes and then the rest of the face. So eyes, because it needs moisturization. You can start doing this after the age of 20. I know it's too early for some people, but your under eyes start coming out by that time. So you need to moisturize. That is the time when your moisturization will actually reverse the effect of darkening. So use the antioxidant serum around the eyes and then you go to the next step. So the eye cream, a specific eye cream will contain a sunscreen also. So there are eye creams available for the morning time use and the nighttime use. So you need to differentiate which ones are to be used in the morning. They do not specify it on the label. So you need to check if they have any actives or not. Is there any retinol in it or not? Is there any acidic component present in it or not? If there is presence of these two things, you should not be using it in the daytime. These need to be used only at night, because in the daytime these things actives make our skin more dry. If we are exposing ourselves to sunlight or even a computer, that is ultraviolet light, it kind of damages more. So do not use these eye creams, but moisturizing ones, vitamin C creams, hyaluronic acid creams, these can be definitely be used in the morning time. The more you moisturize, the best treatment for under eye dark circles is moisturization. So keep moisturizing. That is one thing which I keep telling patients, but that is the most basic step forgotten by most. So let's go to the next slide. Now, spot treatments, do they need to be done in the morning time? In the morning time, spot treatments happen for rosacea and acne or even dark spots. Now, you can use kojic acid in the daytime. You can use antibiotic gel creams in the morning time. So on the spots of acne, you can definitely put these creams. So they need to be applied before you put the sunscreen, because your sunscreen otherwise will form a layer over the skin and these actives will not reach there. So spot treatment is meant only after a dermatologist prescribes it to you. Do not do this with your own intuition, I would say. Moisturizer, depending on which month we are in. So if we are in the summer months, normally moisturization has to be water based. If we are in the winter months, we need to use a little cream based moisturization. But again, for acne prone skin, use only non-comedogenic products. This word is written on the products, non-comedogenic. That means it will not give you acne. So any moisturizer is not for you. You need to check which moisturizer is meant for you and then use it. Step 3 is your sunscreen, last one. I would call it step 3 again, because cleansing, moisturizer and sunscreen, these are the 3 basic steps. The add-ons which we had are meant for specific things. If you have a problem, use it. Otherwise, it's not a must for you to use it. The step 7 mentioned here is the sunscreen, because we've added all the steps in between. Now a sunscreen needs to be a basic SPF 30. It can be physical or it can be chemical. Now, if you are somebody who applies makeup every day, then the sunscreen can be added into your makeup. So if you are using a product which has iron oxide, that is by itself a sunscreen. You don't need to use a sunscreen particularly. So this is especially true for people who are always having a makeup on, air hostesses or somebody who's in the front desk who needs to be always prepared. For them, they should choose a makeup which contains iron oxide in it. They do not need to use a specific sunscreen then. It's a physical block. It's the best type of sunscreen they are using. Now, somebody who's indoors or in front of the computer, they need to use a IR blockage sunscreen. That is your infrared blockage sunscreen, or the blue light filter, which we put normally in front of our computers. We can even put it on our face. So that is something available now in the market. Use a lighter sunscreen so that you can always top it up with a moisturizer if the need be, if you are a oily skin person. So I always tell patients who have oily skin and acne prone skin, do not use the moisturizer unless and until your sunscreen is not providing it. At least not in the daytime. Otherwise they feel sticky and then they wash off even the sunscreen. In the night, yes, you need to use a moisturizer. If you're not using a moisturizer, your skin will feel dehydrated at the end of the day, even in summers. But daytime moisturization for oily skin people in summers is not a must. But in winter months, yes. Before the sunscreen, use a water-based moisturizer. It will keep you fresh throughout the day. You can even carry those mists which we spray on the face. That is just water, and it is basically tonic water. You can even use it in winter months, in summer months, depending on where you are, if you're feeling sticky and dry. Can we change? Yeah, so this is regarding the chemical sunscreens, which I was mentioning. So in summers, wash your face, add a toner, apply the serum, apply the eye cream, use the spot treatment, use the moisturizer, then the sunscreen. You can skip out a lot of this. But in the night, what we need to add is the last two pointers which I've added in. So apply the retinoid, apply your face oil. So if you are people having aging skin, or if you're having acne prone skin, then we need to add a retinol to it. Retinol is basically anti-aging active. It kind of reverses your aging. So we need to add it into our routine after the 30s. It is a must to add, because otherwise fine lines, wrinkling, the drooping chin, you get jowls over a period of time, wrinkling ear. So all of these are a part and parcel of skin changes which will happen after the age of 30 till we are alive. So something we need to use always at night would be a retinoid. If you are not tolerating retinoid, add a hyaluronic acid to it. You can add a vitamin C to it. So these are all actives which need to be used in the night. Younger patients, 20 to 30s, acne prone skin, again, a retinoid works the best. We can even add lightening treatments to it in the night. So when we talk about a day routine and a night routine, the only change in the night routine which we are having is the actives. We put actives in the night because there is no sun damage, there is no phototoxicity happening on the skin. So our skin has time to heal now. So that's why we add the actives. Do not use products which are available online. When they mention daytime, but if there is an acid in it, do not use it. Again, all acids to be used in the night except for ascorbic acid. Ascorbic is your vitamin C. Face oils, again, not a must for all of us. It depends from patient to patient. Somebody having dry skin, they like face oils. The essence is good, that they use it in the night. The next one. So the night regime, as I said, we add all the boosters, all the essences, everything in the night. The regime which we will follow is something I will come up to it. So what steps to follow? How do we layer it? How much time do we need to give between two applications? If we have time, again, of course, an hour or two is good. So once you reach home, wash your face, apply a moisturizer, you are set for the evening. When you go to sleep, apply the actives on the face. First thing you need to apply is apply the eye cream. Why? Because it protects against the actives. You never apply a strong active around the eyes. So when you apply the night cream first, it forms a layer on the eye. On that, when the actives touch, it will not irritate the skin. Otherwise, you'll find redness and irritation around the eyes when we apply an active product. So retinoids and all, again, very mild proportions are applied around the eyes. Unless specifically advised, do not use it around the eyes. An eye cream is just specifically meant for moisturization. So that's what I spoke about. So serums and peels. When we talk about peels, there are peels which we do at home. So there are glycolic acid peels which are given to be applied at home. I normally divide a few days for the peels and few days for retinols. Now you can even combine it with your serums. So vitamin C serum, hyaluronic acid serum. So there are a lot of options available for you. We'll go step by step in the disease wise. Now, if you have rosacea, rosacea is the disease of redness. You get red skin, red patches on the face whenever you are exposed to sunlight. So your day regime has to be sunscreen first, moisturization and sunscreen, and even an antibiotic gel if it is to be used before the sunscreen. What happens once you come back home? So once you're home, wash your face with the cleanser, use a toner, use your active for the rosacea given to you by the dermatologist on the areas which are red. That is an immediate thing to be done. In the night, only thing you have to do is apply a moisturizer. Next step, when we have acne along with rosacea, the same steps in the morning, in the night, once we wash off with a salicylic acid cleanser or something which will prevent acne from coming, then you step it up with an antibiotic gel or you apply a retinol. So the stepwise what sequence to follow is always given by your doctor. When we do it at home, sometimes we miss out on the steps and we forget the most important aspect of it, or we apply too much of it. So if you have a rosacea, you apply all over the face, you don't apply anything on the eye. And if it goes near the eye, even your eye would be swollen, your eye would be red. So you would definitely say that I used the right product. I wouldn't say no, but the amount used was wrong. The the time kept was wrong. So some treatments are just spot treatments for 15-20 minutes, or even initially for half an hour for your skin to get used to it. If we suddenly step it up to 45 minutes, of course you're going to get a reaction, of course you're going to get a burn. So it's something which is not always mentioned on the pack, that you need to go stepwise. So before starting any acid peels or any acid treatments at home or serums which are strong, always first meet your dermatologist, decide on the protocol, and then start using it. There is no need to change it if it's suiting you. So too many steps, it increases the risk of irritation, decreases the likelihood of the desired results. So pick your choice very wisely. Pick up the problem very wisely. You have the issue which you need it sorted. Immediately you first treat that. So when I have an acne patient, he keeps complaining about the marks. Tell him first get rid of the acne. Your new acne is going to give you new marks. So first things first. The second thing would be there. It's waiting for us to be treated, but then finish off what is the immediate problem right now. So choose between prescription meds. Again, it's a choice. It's always given to you by the doctor, whether you want to go for topical therapy, just applications, you want to go for in treatment, in clinic treatments, or you want to do at home treatments. Everything is possible on paper and you can follow it up at home. I have patients who talk about a lot of exfoliation. So they use the rollers, the jade rollers at home. Now, when you have acne, you can't use a roller. It just spreads the infection. If you have acne prone skin, you are using topical retinoids and all, your skin is already dry in particular places. If you try to exfoliate in such a case, even home exfoliants like multani mitti or basin, it's not going to harm you on a normal skin. But if you have a treated skin or if you have dry irritable skin, using that will give you burns, a superficial burn. So exfoliation has to be first tried out on areas where you are not exposed to sunlight. If you are comfortable, then go ahead with it, but never more than once a week. Riddhi, next slide. So moisturizer or a night cream. As mentioned here, some people use the same moisturizer in the morning and night. If you have an extremely dry skin or a atopic skin, we call it, you can always use a heavier moisturizer in the night, which is meant to stay there for at least 24 to 48 hours. So even after washing, it remains on the skin. So it kind of helps you in the next day. So this is something like preparing your skin for the next day. Next one. So this is in short what I have been talking about, the day and the night. It's available on online, almost all the platforms. All you need to follow is to use the right thing. Do not use treatment options by yourself. Select what is your problem and then decide with your dermatologist. Always take opinion so that you don't land up getting the side effects of these products. So I've mentioned your AHA, BHA serums. Now, what is AHA? It is alpha hydroxy acid serum. So that is what I meant by salicylic acid, glycolic acid. These are the acids which are used in the treatment of acne. You can use these as serums. They are available now online also, or you can use them in your cleansers. I prefer cleansers because it is easier for people to carry it around with them. It's not something they have to specifically use because you are going to wash your face any which ways. So that can be combined with your cleanser and that step can be removed kind of. So in serums, it's an optional thing for patients. Some people like to use serums, they like the feel of it. So of course, we add these serums for their skin regime. A matte sunscreen is, as I said, it looks like makeup, but it is something which can be used as makeup, but it's not actual makeup. It is a sunscreen which looks tinted. So for patients having to use a makeup always, they can go for these matte sunscreens. The next slide. So during winters, creamy face washes preferred. People having very dry skin, sometimes even washing with water is fine. Some people have extremely dry skin. So the minute any soap touches their face, it becomes bad. So you can just use a normal cleanser like for very sensitive skin, like a Cetaphil cleanser, which is something easily available in the market. You can use it to wash your face. It will not be very dry. It will instead moisturize when it's being washed off. You can even use soap-free cleansers, water-free cleansers. You don't need to use water, just dip them in cotton and clean your face with it. This is for very dry skin patients. But when we have patients with oily skin, you can use your products the way you normally use. So that skin is not going to suddenly become very dry. You can consider using just foam-based products instead of the solutions. So that also helps in oily skin patients. So I will come to this question later on. So whether to moisturize your skin in summer season or not, many patients do say that it's extremely sticky to moisturize. I would not want to moisturize. The actual sun damage which happens to the skin in the daytime is something which needs to be treated at night or in the evening time when the sun is not there. Your moisturization is important there. You can always use the Hydra Boost or a water-based moisturizer so that you don't feel sticky. The only regimen I allow patients to use in the evening, other than spot treatments, is go for a moisturizer. After 6 o'clock, if you're not in front of the computer, consider using your sunscreen off, put your sunscreen off and use a moisturizer. That's it to be followed. In the night, the actives definitely will come. In winter months, especially, use the moisturizer, the water-based one, again to repair the skin which is going bad. For dry skin people, change the moisturizer from a very light one to a heavier based creamy one so that it does not crack, it does not flake. So choosing a moisturizer according to your seasonal changes is important. Sunscreen in the summer months, if you have oily skin, you do not need a moisturizer. Your sunscreen acts as your moisturizer. In winter months, you might want to use the moisturizer, then layer it up with the sunscreen. So when we went in the steps, we came to the sunscreen last. In there, in winter months, you can add your moisturizer before the sunscreen comes in. So you need to hydrate the skin, you need to renew the skin. This will help the promotion for collagen and all. So using a moisturizer in all the seasons becomes a must. The next slide, Riti. I've already finished that. Again, hydrating yourself internally is also important. I suggest 3 bottles of water, this much big, 1 liter water bottle. Carry it with you, at least 2 of them. One, keep it at home so that at the end of the day you finish it. It's something which is difficult to follow for newbies, but then once you get into the routine, it's extremely good for your skin. You wash off all the products which are not important for the skin, all the toxins which are generated in the skin. So instead of eating having more juices and all, eat the fruits that has antioxidants. The fresher it is, the better. Hydrate yourself more. So drinking in more water always helps. Of course, in summer season, hydration helps in preventing dehydration also. So how would your skin react if you're not hydrating yourself? So your skin starts developing rashes. It gets burns if you are extremely dry and in sunlight, even with a sunscreen, because you are extremely dry. So it is something not advertised, but even with a sunscreen, you can get a burn if your skin is extremely dehydrated. So drinking adequate amount of water always helps. Let's go to the next one. So as I already mentioned, alter your cleanser, go to a foamy cleanser instead of using a creamy one. Change to serums. Again, why? Face oils in winter months, you will really like it. But in summer months, they will give you zits, breakouts because they clog all your pores. So do not use oils in these months. Use your serums better. skin maintains your moisture, it generates more oil. So we need to moisturize or not. I mentioned that earlier. We need to moisturize, yes, in summers. In summers, also use mist so that you keep hydrating that skin. So your sunscreen is not going to wash off. Most of them are waterproof. So you using a mist is not going to change that, but it will make you feel fresher in the long run. So let's come to the next topic, the hair care. So I'm going to change this a little when I'm talking about it. So how often do we shampoo our hair? We need to shampoo at least alternate day, thrice a week if you're living in Mumbai, because we are in a very humid climate. Our scalp will just get oily. It will start flaking if you don't wash. So I have patients who say, I wash once in a week, but why is it so flaky? How do you expect it not to be flaky? Because your scalp is regenerating. And if you are in a humid climate, it will have fungus in it. So that will again give you dandruff. You need to wash every alternate day, at least in Mumbai. Remove time for yourself and do it. Every time you wash, what do you need to use? Every time you wash, you need to oil your hair. It's important. Yes, Dadima ka nuska, but it works. How do you oil your hair? Oil the ends. These need to be oiled. You don't need to oil here. So I know it's difficult to remove it. And if you do oil there, you need to wash it off at least 2 hours after. 1 hour is also enough. Sometimes just apply and go, because it will prevent dryness. Whatever shampoo you use, whether you're using a sulfate free shampoo or a sulfate shampoo, it helps to maintain the moisture in the hair. It forms a layer or barricade against the shampoo product. Now, the which shampoo to use? We have sulfate free products now available over the counter. We have normal shampoos available over the counter. I'm going to ask this question to others later on. What do they prefer to use? I tell them two things. Do you have scalp dandruff? Do you have oiliness of the scalp? Use a normal shampoo. Don't use a sulfate free shampoo. You don't need a sulfate free shampoo. Sulfate free shampoo is for people having really dry scalp with no flakes, extremely sensitive hair, which keeps breaking even on combing. So these are the patients who need a sulfate free shampoo, or if you have a treatment done on your scalp. Even to patients who have done treatment on their hair, like a keratin or a protein treatment or a booster treatment, they tell you to use a sulfate free shampoo because they want you to maintain the product more on the hair. They want the hair to remain better that way. But that does not help your scalp. Your scalp is getting oily, it is producing dandruff. So if you have a oily scalp and a dandruffy scalp, use your anti-dandruff shampoo at least once in a week, even though it is not sulfate free, if you want to maintain your hair. Otherwise, you'll experience hair fall, you'll experience increase in the dandruff, experience acne breakouts because of the dandruff. You'll experience trunk or chest acne because of the dandruff, because you are using a sulfate free shampoo. So choosing a shampoo is important in how other things reflect on your face and body. Gel or mousse, that is something I after the shampoo, preferably use a conditioner. Use a leave-on conditioner if your hair is extremely frizzy or dry. After the hair is dry, use a gel or a mousse. For men, they prefer using something to style their hair. I have absolutely no problems with that. They can use it. So hairspray or dry shampoo, I do not advise it, not in humid weather, because it will not stay. You will not feel clean at the end of it, even if you're using a very good product. Let's go to the next one. So many people have a habit of blow drying their hair. I would suggest you leave your hair the way it is, or you towel dry it, or you keep it in a cloth and allow it to dry. Why so? Because it will, when we blow dry our hair, the bubbles enter inside the hair shaft, and they make them more friable. The breakage becomes small. Once they are dry, definitely can do it. Use a heat protection serum and then style your hair. It of course takes time, but then that's something we need to follow to keep our hair healthy. Otherwise, they start breaking off. You'll start getting split ends at the end. And use a wide tooth comb always on the wet hair, never a thin comb. Even if you're styling it, still use a wide tooth comb. The next slide. So if you already have got issues with the hair, get a trim. Yes, I don't suggest cutting them off really short. It takes time for your hair to grow. So if you want a 6 centimeter hair, you take 6 months to grow that much hair. So do not chop off your hair just because you're losing hair. There are better ways to treat it. Trimming is just a last 1 inch, which sometimes gives the hair the boost to start growing. Take your vitamins. Which vitamins to take? There are hair vitamins available over the counter which contain omega-3 fatty acids, which contain biotin. Your biotin content has to be more than 500 microgram. If it's more than that, it's always good. Take it. Along with that, collagen helps. So collagen tablets are now available. Collagen powder is available. You can have it with milk and a lot of other things. Those are also extremely good for your hair. If you still notice hair fall after taking these vitamins and omega-3 fatty acids, get yourself tested. Sometimes it's a basic anemia. You've lost a lot of blood due to whatever reasons happening, or normal menses, or any surgeries, or if you've had any illnesses in the last 6 months. Now, when your body is trying to recover, your hair is the least important thing for your body. So you will experience a lot of hair fall or dryness or frizziness. So treating the cause sometimes helps. So if you have anemia, you treat the anemia with your iron and folic acid, your hair comes back to normal. So it's not always cutting off the hair which is helpful. It's more what has happened, and you treat the cause, and then it is helpful. For younger kids, teenagers experiencing hair fall, a lot of dietary issues are in. They eat junk. They are, if they are into extremely healthy diet, again they are not having a lot of omega-3 fatty acids and all. So sometimes just evaluating their diet and giving them the right direction helps. The next one. So a lot of people use hot showers while bathing. In winter months, especially, you will notice a lot of people using hot showers. I would suggest, say, take a hot shower. At the end of the shower, take a cold shower. You need to end it with cold so that the cuticle closes in. So that's what I have mentioned. Avoid using hairstyling tools, especially curlers. They tend to damage more. Always use a heating serum if you are planning to do any kind of styling. So wrap up your hair. It's difficult in humid climates, but if possible, do it. Hydration, use an oil always before you go for a head wash. If you are having colored hair, again, the oiling helps in maintaining the shine. You can use your metallic toners, the salons provide. You can definitely do that once in a while to refresh your color. But before every wash, oiling will prevent dryness of that same hair. So oiling is not a no-no. Definitely should do it, but do not keep it overnight. You will break out if you have oily skin. So do not keep anything overnight. Just do it before you go for a wash. That's it. So this, Riddhi, this is for your question. In which season should I get hair fall? So this is showing the hair fall is maximum in summer months as well as the spring. So yes, it does not happen in those months. But with what does this graph show? It's basically an animal shedding graph. This is not what we follow. So we have an anagen phase, which is the growing phase. It comes in after 3 months. The hair fall stage starts. Then for 3 years, we have that growing phase. So that growing phase usually ends by August, September. So you can say in the autumn months, you will experience more hair fall, not in the other months. Winter months, because of dry scalp. In winter months, if we are not taking care of our scalp, your hair fall will increase. Summer months, you would not notice much change. The next slide. So there, your hair gets better in winters. And especially in winter months, if you're taking good care of your hair, like conditioning it, taking your multivitamins well, I usually suggest patients to take it 3 months every year, because especially if you're a vegetarian, we do not have biotin in our diet. We take very less protein in our diet. So for vegetarians, at least 3 months in a year, they should be taking hair vitamins so that they maintain the hair quality. It's not overdosing, it's actually underdosing, because you are not taking anything throughout the year. So out of 12 months, you take it for 3 months. That's it. More than enough for your hair. So yes, that's it. Let's open up for the questions.
All right, I'll just stop sharing the screen
Yeah.
and I'll read out the questions that we've got in the chat box. Somebody has mentioned, can you just repeat for dark circle?
So
I
for
think they,
So for
yeah.
dark circles, we can start with the morning routine. If so, let me just ask. We go back to the history. Now, sometimes a patient has a hereditary factor, like your parents have had dark circles all their lives, then you are bound to get it. So,
Mhm.
doing a treatment for the dark circles, I would not suggest doing a in-clinic treatment for such patients because they would always be dissatisfied. If they
Hmm.
don't sleep for one night, their dark circles are back. So
Right.
it's something you need to follow on a everyday basis at home. So for them, one, moisturization every day. Second, after the cleansing in the morning, use a eye cream which is meant for the morning. So there are creams which have sunscreen in it and vitamin C in it, which can be used in the morning time. If you
Right.
do not want to use a morning cream, you can use a vitamin C serum in the morning before the sunscreen. So again, all of this help in the daytime. In the night, preferably once you clean the area, cleanse it, use your toner, apply the eye cream which is meant for lightening. There are specific products in it which contain vitamin C, hyaluronic acid for moisturization, as well as moisturizing factors which can be used in the night. So this kind of helps the lightening process. Again, drink more water, eat more antioxidants, that is your fruits and vegetables, will help in the under eye dark circles.
Right. Okay, I hope this was an anonymous question, so I hope it's answered for you now. Next we have here is, can we use micellar water spray for daytime?
Yes. So instead of micellar water spray, I would suggest use a water mist. It is plain water which is in the mist form. Micellar water sometimes, if used in a lot of quantity, will remove your sunscreen and your makeup.
Okay,
So it will definitely increase your work because you will have to redo it again. Using plain water on a waterproof sunscreen definitely helps better.
okay. So Sakshi, I hope you got your answer. Another question we have here is, how is La Shield SPF 50 plus for sensitive skin, which is prone to eczema?
So if you are prone to eczema, La Shield is good because it is what sunscreen you mentioned is a physical sunscreen. So it kind of coats the skin. I would still suggest use a moisturizer before you use the sunscreen because it will form the double sandwich layer. So your skin has a moisturizer, over that you have a sunscreen. So you're sandwiching the moisturizer, you will not get eczema more often. The sunscreen is definitely very good. So if it's suiting you, continue all the months. You can use it all throughout the year.
Right. Great. Another question that we have here is, do dry curly hair should also need to wash hair every alternate day? Weather of Chandigarh is what they're saying.
Weather of Chandigarh is cold. If you have dry, frizzy hair, at least once or twice a month, get a deep conditioning done. Get a
Hmm.
trim taken, at least the ends become better. And oil every time you wash your hair. Oiling will help in the form of coating that hair shaft to make it more shinier. Do not try to remove the oil when you go for a wash. If your scalp is dry, use a sulfate free shampoo. If your scalp is clean and dry, there is no dandruff, use a sulfate free shampoo because it will maintain the moisture of your hair. It will not remove the excess oil. So it will kind of leave on something on the hair shaft to make it appear shiny. Use a serum over it. You can use any serums, your argan oils over it. So definitely helps in hydration of the hair.
Okay, great. That was another anonymous question, which we just answered. Next is, can you suggest sunscreen for indoor use, a topical retinoid, and a moisturizer for combination skin? So,
Okay. The entire thing. Okay.
yeah,
So you have a combination skin, you should go for a sunscreen which is matte finish so that your oily patches do not become really oily if you're using a normal moisturizer. So if you are indoors but you are going to be cooking or you're going to be on the computer, then infrared is important protection which you need to have.
right.
So it's not something we should skip out. So there are IR available products like UV Dux Blue. It is a blue filter. La
Mm.
Shield, La Shield Light, I think, or UR. There again, it is available with a infrared filter. These are the sunscreens which are available with IR code on it. You can definitely use them indoors. Retinoids, there are creams available in gel forms in India. So not the serum formulations. So in gel forms, you have Ugard, you have Ikran, you have overnight anti-aging creams available in Sebamed, Q10. All of them contain retinoids. Now,
Hmm.
if you have a combination skin, I would not suggest you using a hyaluronic acid, which acts as a moisturizer. So none of these products should have that. Instead, go for a water-based moisturizer so that your oily skin does not break out. So there are Neutrogena products available which are water-based, like Hydra Boost. There are water-based products by Cetaphil, your Cetaphil moisturizer for oily skin. So you can use those moisturizers. Now,
Okay.
use the cleanser, use the toner, use your night cream, and then use the moisturizer in the end to layer it all up. So that's the sequence you should follow.
Okay. Please quickly start with the questions because a lot of them are coming in now. For oily hair, which type of shampoo we can use?
So use a sulfate shampoo. All the over-the-counter products are sulfate ones. So there's Head and Shoulders, there's Pantene, there's Sunsilk. Use any you like, flavor you like, the fragrance you like. It's not dependent on what you are using. It's more about how much you're washing it off and then conditioning it. So your conditioner is always important. Use the product after your shampooing.
Okay. Right. So this is by a guy now. He's saying that I have hair fall and hair gray problem. Density of gray hair is increasing every day. Please guide.
So, if you are having gray hair, I would suggest you to start multivitamins because the commonest reason is you are deficient in biotin or collagen or calcium or vitamin D3. If you are after the age of 35, you are older than that, then reversing that gray hair becomes difficult. So,
Right.
possibility of that gray hair becoming black is definitely gone, but then at least new ones will not come up. So, you can start with the multivitamins. There are topical applications called Grey X, which, if used on the scalp every day, twice a day, before the age of 35, of course, can reverse back the graying of the hair.
Okay. Right. So there was another question, I think, for gray hair, which we've covered now. So how to take care of dry skin, like which products we can use on face?
So on face, if you have dry skin, all the seasons you need to use the moisturizer. You can use a little creamier based sunscreen. Don't go for the matte sunscreens. The
Hmm.
the matte sunscreens will be definitely more dry. Use for a you look for a creamy base. If you don't want to look a little oily, use the moisturizer first and then use your matte sunscreen. So products which you can use are Cetaphil creams, when Dr. Reddy's Venusia creams, there's Avino cream. So if you have dry skin, the entire spectrum is open for you.
Hmm.
So it's not very difficult. Whatever you select is not going to give you any breakouts. Just use something which stays longer than 24 hours so that it can continue to hydrate even after we wash. Use a gentle cleanser. Never go for a very strong AHA, BHA creams, even
Hmm.
online ones, and use serums. Vitamin C, hyaluronic acid, all of them will help you. Do not use retinoid, that will cause more dryness.
Okay. There's another one for oily skin. Can we use aloe vera gel as night cream?
So you have so many other things to use. Why do you want to use it as a night cream? Aloe
Yeah.
vera gel can be used as a pack any time of the day. So for oily skin people, it does wonders. You can even do the ice therapy. Just dip your head in ice cold water and you'll feel nice. The oily skin people. But
Hmm.
in the night, you can use something to reverse back whatever effects have happened. So why not use actives instead of using aloe vera? Aloe vera is just moisturizing your skin.
Right. Next one here we have is I have a pimple that keeps on happening again and again at the same place on my face. I have got many treatments done, but it is of no help. It is not painful though.
So it might not be a pimple, I feel. If it's coming at the same place again and again, normally an oil gland, if it is present on that very same space, and if you've done treatment, it will not regrow on the same space. So if you're talking about an area like a cheek or a chin, then definitely treatments are available. If you have not used anything topically, then use retinoids, use adapalene gels, which are available over the counter. But again, always use a sunscreen if you're using a retinoid at night. And your cleansers should have salicylic acid and all. But first, get it checked. I feel it might not be acne. If it is at the same spot, it might be a cyst or a sebaceous gland which is bloating up every time, because these are not painful. Acne is painful most of the time.
Okay. Somebody has a question for their parents. They've written, my parents now have white spots on their skin. They are 60 plus. Is there something concerning or just age related?
So if they have white spots on this area or on the knee below, those
Mhm.
are age related. If they have spots elsewhere, then yes, it needs to be checked under the UV lamp to see whether it is vitiligo or not. That is your leukoderma in normal terms. But if it is coming as spots on the extremities just below the elbow and knee, that is a very natural process after the age of 60. So it's nothing to be worried about.
All right. The next one here is I have shifted to Mumbai from Delhi and my hair have become super frizzy and hair fall has increased. I have always used dry hair. I have always had dry hair. Can you suggest shampoo and conditioner?
So, how often are you washing the hair? Especially in Mumbai, you need to wash more often. One, you can shift to a milder shampoo if your hair is getting extremely frizzy and dry. Use products, the conditioning products need to be a little lighter. If you're using extremely oily stuff, then they will remain limp. So, your conditioner is also important. You're using a serum, a lighter serum helps. Using a oil which is lighter, don't go for almond oil or argan oil, go for coconut oil, your parachute works fine. So before your wash, till the end of the wash with the conditioner, choose your product correctly. It should be fine. Um, One other thing is, since we are in a humid climate, I would not suggest if you are using a very heavy conditioner, as I said, or a heavy gel cream or a hair cream, which normally is fine in states which are indoors. I mean, which are landlocked like Delhi. But Mumbai, being a coastal city, we are going to be extremely humid. So expect a little bit of frizziness. Doing a hair treatment for frizziness works here better because it keeps your hair controlled.
Right. Another one we have in the Q&A boxes for the hair vitamins, can we have every 3 days or do we pick any 3 months?
Which three ones are they talking? Have they mentioned which three vitamins?
No. So
So
this is by Mansi. So Mansi, if you can specify which 3 months. I mean, I think she when
three
she was
months. Okay, okay. So any 3 months, I would ideally suggest, since we expect a hair fall happening somewhere around August, September, I usually suggest 3 months which are starting from your rainy season.
Hmm.
So you kind of cover up your deficiency by the time you're going to experience hair fall. So your hair growth restarts by that time. So after the months, summer months, you can restart. So July, August, September. July onwards, definitely should start.
Right. All right. I hope we've answered your question, Mansi. Couple of questions in the chat box also here. Which moisturizer is best for dry skin that will keep your skin hydrated?
So as I said, Cetaphil for dry skin, Avino for dry skin, Venusia for dry skin, Bioderma for dry skin. So these are all products which are meant for extremely dry skin.
Okay. Great. There's somebody who wants to know when should we eat multivitamins, any particular time of the day?
So if you're taking calcium or vitamin D and your multivitamins, definitely space them out. You cannot take them together. The absorption is uh, it differs. So calcium should can be taken at the end of the day. You can start with the multivitamins in the morning and vitamin D once in a week on a Sunday.
Oh, great. And how often, like I just want to add to the question here, how often do we need to have vitamin D then? I mean,
Vitamin D after the age of 40 is a must. You should continue taking it because we barely get any kind of vitamin D.
so it
It's
can
not
be
a sun-
continued all year long on every
Yes.
Sunday.
Yes. So the
That's
dose
okay.
which you take on a weekly basis is a very minimal dose. It's not a very strong, it's not 60,000 units you're taking in one go. It's barely. So once in a week kind of maintains it at a good level. You are not um, creating any vitamin D toxicity in the body. Because when you take those bigger products for a longer duration, then the side effects can happen.
Okay. All right. Great. I think couple of last questions here. Somebody is asking, how do I control hair loss? I have very thin hair and dry scalp.
Okay. So for you, somebody like you should be using a sulfate-free shampoo. So the hype which is there, it's for dry scalp, it's for very thin hair, it's for frizzy hair, it's for breakable hair.
Hmm.
So use milder shampoos. If you don't wish to oil, it's okay, but use a serum at the end of the wash.
Hmm.
Conditioners also are go for you because your hair is straight and fine. So again, the conditioner will make it limp. So use a serum instead after you wash your hair before we comb the hair.
Right.
Multivitamins here will help you because they increase the tensile strength of your hair, and collagen will also help you. Taking a collagen on an everyday basis increases the thickness of the hair shaft. So why not take it?
Correct. All right. Somebody's again put in the chat box. What is the frequency of vitamins for collagen biotin? He is, I think,
Collagen is
31
twice.
from Punjab. Sorry.
Collagen is twice a day at least, and you get those powder formulations. You can take 1,000 micrograms every day of biotin along with it twice a day. So there are no combinations of biotin and collagen. They have to be taken separately. So
Okay.
it's something which you need to pick up on 2 separate bottles and then take it.
All right. Got it. Can you give the strength of vitamin D on weekly basis, like how many units, any
So
particular?
vitamin D3, you get a price D3. I think it is around 8,000 international units. So it should be enough. And if you're taking calcium along with it, somebody above 50, we add calcium along with the vitamin D. So you get Shelcal D3 combinations which are available again. So at the end of the week, you'll get a D3. Rest of the days, you take your calcium. So
Okay.
it's available over the counter also.
Perfect. I think I've got just one last question here. Again, related to frizzy hair, I think they live in a humid place, regular hair fall and frizzy hair. This person uses coconut oil and sunsilk shampoo from childhood. So is that okay? Is what she...
Absolutely fine. Absolutely fine. Continue using it. Just condition it at the end of your wash so that the frizziness goes away. Use a serum to control the frizziness of the next day also. So
Hmm.
on day 2, the serum helps better. After that, you are in for a wash again. You can always do deep conditioning. Again, in humid climate, it helps because when you do a deep conditioning, it improves from your root. So
Hmm.
at least once or twice a month, definitely should go for it. Or do it at home. Do a hair mask at home.
Perfect. So somebody's also asked right now, do you have a clinic also for appointment? So yes, she does. Like I said at the start of the event, she has a clinic in Ghatkopar called Radiance. And Dr. Avani, you can note down the number here or a website on the chat box so everybody can access it in case.
Okay, okay, I'll do that. I'll just add on to it.
Yeah. Anybody who needs an appointment or a proper consultation, please refer to the details putting that Dr. Avni is putting in the chat box. Anybody, any last questions? We're going to be wrapping up now. I think your this has gone to host and panelist. I,
Oh, okay. Yeah.
the chat.
So I have an Insta handle, Maniar _ dermatology. You can visit me there. I'm there on the Google as Dr. Avani Maniar. So you can visit me there. I have my details there. The Radiance, I'm just putting down my uh, contact details there. Yeah, visible to all?
Yes, I think it is.
Yeah.
So everyone, the details are there and you can contact Dr. Avni anytime for an appointment. Thank you so much, Dr. Avni. It was such an informative session. Like it's really important for, generally people to know such basic rules for their hair and skin. And thank you so much for taking out this time and, giving us and sharing this information with us.
Thank you. Thank you so much. And I had a great time answering your questions. And definitely, if you have queries, do post it to me on the Insta handle or come down and meet me once if you're in Mumbai.
Right. Anybody has any questions can route it through us also. We'll be happy to share Dr. Avni's contact details with you guys. And thank you everyone for attending the event. Thanks a lot.
Bye.
Have a great week ahead. Bye-bye.